COVID cases surge in California. Is this the start of the summer wave? Are we on the brink of a summer COVID-19 surge in California? The numbers are climbing, and it's a chilling reminder that the pandemic isn't over yet. Let's dive into the latest data and see what's unfolding. The Centers for Disease Control and Prevention, CDC, has noted a troubling trend. COVID-19 infections are on the rise in roughly half of the U.S. states. Their latest update, released on a Friday, highlights a significant increase in COVID-19 activity across more than 24 states, particularly in the Southeast, South, and along the West Coast, with California being a notable hotspot. Nationally, the virus levels have shifted from very low to medium in just a week, according to wastewater monitoring. This upward trend is a clear indicator that we might be heading into another wave. But here's where it gets controversial. Some experts argue that the current surge is nothing to worry about, while others see it as a red flag. In California, wastewater surveillance has confirmed that the virus is spreading rapidly. Wastewater Scan, a national program that tracks viruses in sewage, reported that 95% of the sites tested in the state showed traces of the virus. And this is the part most people miss. The amount of virus detected has been increasing since June, suggesting that the summer wave might already be underway. Researchers have noted that virus levels tend to rise during the summer months, a pattern we've observed in recent years. Last month alone, an average of 150 people died each week from COVID-19, according to the CDC. This sobering statistic underscores the ongoing threat posed by the virus. Public health experts point to several factors driving the summer rise in cases. Increased travel around the July 4th holiday, large gatherings like concerts and sporting events, people spending more time indoors during heat waves, and waning immunity among those who were last infected or vaccinated more than 6 months ago are all contributing to the surge. Current virus levels are slightly below those recorded at this time last year, but the steady rise mirrors familiar seasonal patterns. Genetic sequencing from wastewater samples shows that the NB.1.8.1 variant is currently dominant, making up 33.2% of sequenced samples, followed by XFG at 24.6%. The NB.1.8.1 variant, nicknamed Nimbus and informally referred to as the razor blade throat variant due to reports of painful sore throats, accounts for 7.5%. Despite its ominous nickname, there is no strong evidence that NB.1.8.1 causes more severe illness or higher hospitalization rates. However, public health officials continue to recommend vaccination, testing when symptomatic, and mask use in high-risk settings. Dr. Peter Chin-Hong, an infectious disease expert at UCSF, advises that older adults, immunocompromised individuals, pregnant persons, and infants, especially those under 2, should ensure they have received a COVID vaccine within the past year. A CDC analysis published on a Thursday suggests that COVID-19 has settled into a twice-yearly pattern of surges, typically peaking from July through September and again from December through February. Scientists attribute this cycle to genetic changes in the virus's S1 region, a key part of the spike protein that enables the virus to bind to human cells. Historically, California's summer wave of coronavirus cases peaks around mid-July to late August. As we approach this critical period, it's essential to stay vigilant and follow public health guidelines. But here's a thought-provoking question for you. Do you think the current surge is a cause for concern, or are we overreacting? Share your thoughts in the comments below, and let's spark a discussion on this pressing issue. COVID-19 cases rising. Summer wave hits U.S. Brace yourselves, COVID-19 cases are surging again this summer, and the CDC has the data to prove it. Sarah Maniusco, a seasoned health and lifestyle reporter at CBSNews.com, brings us the latest updates. With a background that includes launching USA Today's wellness vertical, Sarah is now at the forefront of breaking news for CBS News Health Watch. As of July 21, 2025, the Centers for Disease Control and Prevention, CDC, has issued a stark warning: COVID-19 cases are on the rise. Their latest report indicates that at least 26 states, along with Washington, D.C., are experiencing a growth or likely growth in cases. Even more alarming, COVID-related emergency room visits for young children have reached their highest levels since March. Dr. John LaPook, CBS News chief medical correspondent, explained on CBS Mornings that this summer spike is part of a now familiar pattern. "We now know that there's a winter spike and then there's a summer spike," he said. "And every year, the number of deaths and hospitalizations gradually goes down each season. So that's the good news. But here's where it gets controversial. While the overall trend might be improving, the current increases can't be ignored. If it strikes you, especially for the vulnerable, and we're talking about very young children under the age of 4, the elderly, people who are immunocompromised, they can really get sick," LaPook cautioned. Introducing Nimbus and Stratus, the latest COVID variants. The newest COVID variants, nicknamed Nimbus and Stratus, are reportedly no more deadly than their predecessors. Previous variants, like NB.1.8.1 from earlier this year, also did not show more severe illness compared to earlier strains. Symptoms remain broadly similar, including respiratory issues like cough and sore throat, as well as systemic issues like fever and fatigue. The vaccines that were made for this season do cover the current variants, so that's good news, LaPook reassured. "I think the bottom line here is, don't be blasé. It's the summer, people have all sorts of things. Be careful." To boost or not to boost, the COVID vaccine dilemma. While the CDC still maintains that the COVID-19 vaccine helps protect against severe illness, hospitalization, and death, there have been some shifts in recommendations. LaPook admits we're in a bit of an odd period right now because the CDC has different vaccine recommendations than many major health organizations and societies. For example, the American College of Obstetricians and Gynecologists recommends that pregnant people get vaccinated. Because the baby, before they can get a shot, they're really relying on the mother's immunity. The mother has the antibodies, goes through the placenta, and then the baby has some protection, LaPook explained. Health and Human Services Secretary Robert F. Kennedy Jr. has emphasized shared decision-making. "This means it's crucial to talk to your clinician about the vaccine, which is always a good idea, but it's a slightly different recommendation than just saying, go get it." The CDC now recommends shared clinical decision-making for giving healthy children the COVID-19 vaccine. While the agency currently recommends most adults aged 18 and older get a 2024 to 2025 COVID-19 vaccine, it's especially important if you're 65 and older, at high risk for severe COVID-19, or have never received a COVID-19 shot. Where are COVID-19 cases growing? According to the CDC, COVID-19 cases are growing in the following states: Arkansas, Hawaii, Illinois, Iowa, Kentucky, North Carolina, Ohio, Pennsylvania, Texas, Virginia. Where COVID-19 cases are likely growing. The CDC says COVID-19 cases are likely growing in these places: Alaska, California, Delaware, District of Columbia, Georgia, Indiana, Maine, Maryland, Massachusetts, Michigan, Mississippi, New Jersey, New York, Oklahoma, South Carolina, Tennessee, Wisconsin. And this is the part most people miss: even if you're not in a high-risk group, your actions can significantly impact those who are. So, what's your take on the current COVID-19 situation? Do you think the new variants are something to worry about, or are we overreacting? Share your thoughts in the comments below. COVID-19 levels rising in the U.S., what you need to know. COVID-19 cases are experiencing a slight uptick in certain regions of the United States, particularly in the Southeast, South, and West, according to the latest updates from the Centers for Disease Control and Prevention, CDC. While the overall activity remains low, This increase is noteworthy and warrants attention. The rise in infections is primarily indicated by early warning signs, such as emergency department visits for COVID-19, which currently stand at a national average of just 0.5%. However, there has been a significant increase of 10.9% in these visits compared to the previous week, especially among children aged 4 and under. Additionally, the national test positivity rate has seen a slight increase, now at 4.8%, which is up by 1.1 percentage points from the week prior. In terms of wastewater surveillance, another critical early indicator, SARS-CoV-2 detections have risen from very low levels earlier this summer to low levels now, with the highest concentrations found in western states, followed closely by those in the south. States reporting elevated levels include California, Florida, Hawaii, Louisiana, Nevada, South Carolina, and Texas. It's important to note that the CDC has not updated its projections regarding the proportions of COVID-19 variants since mid-June, due to a lack of reported sequences. The last update indicated an increase in newer subvariants, including NB.1.8.1 and XFG. In Europe, the situation is also evolving. Italy has confirmed its first local case of chikungunya since 2017, located in the Piacenza province of the Emilia-Romagna region. This marks Italy as the second country on the European mainland to report local chikungunya cases this year. France has reported a total of 30 cases across 12 different administrative regions, with the largest cluster of 13 cases emerging from Salon de Provence in the Bouches-du-Rhône department. Additionally, both France and Italy have documented their first local dengue cases of the year, with France's case originating from the Loire Valley and Italy's from Bologna province. Earlier in January, Portugal reported 2 dengue cases in Madeira, which the European Centre for Disease Prevention and Control, ECDC, suggests likely involved transmission occurring in 2024. Earlier this month, the ECDC announced the initiation of a new series of updates focused on mosquito-borne illnesses and released guidance on locally acquired mosquito-transmitted diseases across Europe. This situation raises important questions. How prepared are we for the potential resurgence of these diseases? What measures can be taken to mitigate their spread? We invite you to share your thoughts and opinions in the comments below.